Welcome, everyone. I look to Jasmine again for a little bit of help around quorum. And when the full quorum has been here, I think we're a couple members short. So that might mean we need to move some of our business items towards the end. But this is the October meeting for the Jackson County Local Public Safety Coordinating Council meeting. My name is Eric Geyer. I'm the Director of Community Justice for Jackson County, and I also chair this meeting. So we're very fortunate today to have a number of guests from out of town. So today our subject is going to be Measure 110, some of the progress, some of the promise, and then also some of the challenges that we're meeting. I think that this is an important forum for that discussion as we transition some of the substance use disorder response from the criminal justice system to be more of a health and systems-wide concern. And within that comes a lot of promise, and it also comes a lot of responsibility. So we'll be hearing from three different groups today. We've got Ron Williams and Tara Hurst from the Health Justice Recovery Alliance, who will be speaking first. We've got Toni Vesna, who's the Executive Director of Fourth Dimension Recovery up in Portland, but he also chairs the Governor's Alcohol and Drug Planning Committee. And then we have Tanya Phillips, who's our Jackson County Health Promotion Program Manager here in Jackson County, to talk about some of the real concerns about overdose within our community and what we are looking at on a local level in regards to that. So as we continue to gain, and William Nooneman is here also from Lines for Life. I didn't see you, Mr. Nooneman. Thank you so much for joining us. So one of the ways we were going to structure this today is as each speaker has the floor, if you have specific questions, we can utilize the chat for that. But after each group presents, we're going to offer a brief moment for clarifying questions regarding their particular presentation. And then at the end, we'll have some open time for discussion after all three groups have presented, if there's any observations, questions, or comments on a more system level. Even though this is definitely our local Public Safety Coordinating Council, if you do have a question or comment, it might be helpful to identify yourself and kind of the agency or perspective that you're bringing to it. Not that that should matter too much, but it might be helpful for our guests from out of town. So with that, I'd like to turn the floor over to Ron and your group. Ron, you reached out, I think about 3 months ago, offering to make this presentation, and I think you've made it to a few other counties statewide. And thank you for your patience, and thank you for bringing your team to join us today.
Thank you so much, Eric. I really appreciate your help in getting this set up. And like you said, we are doing as many local Public Safety Coordinating Council meetings as possible. We've gotten to many, and we have many more to go. Thank you to Jasmine as well for the logistics of setting this up. My name is Ron Williams. I'm a person in long-term recovery, which I define as being alcohol and drug-free for going on 22 years. And along with me today are Tara Hurst and Billy. Tara Hurst, she's the Executive Director of Health Justice Recovery Alliance, and we also have Billy Nooneman of Lines for Life, and we're going to walk through a presentation here. They'll introduce themselves as we go along. So I'm going to share my screen now, and Tara's going to begin.
I can start with saying hi. Tara Hurst, I'm the Executive Director, as Ron said, for Health Justice Recovery Alliance. I'm also a person in long-term recovery, and we're excited to be in front of you all and just open up. What we've been doing is going through this kind of semi-brief presentation and then just really having a honest and open conversation about the challenges that folks are facing, as well as ways that we can improve. So we're talking about Measure 110, which is now Senate Bill 755. The Health Justice Recovery Alliance is an organization that was really brought together once Measure 110 passed, and it's our mission to implement the measure as the voters intended. So our main values and mission is to ensure that we are moving substance use from a criminal justice system to the healthcare system, which is something that Eric said, as well as really focus on the communities that were most impacted by the war on drugs. And I don't know if you can do the next slide, Ron. Gives you a little bit of an idea. This isn't all the organizations that are a part of our alliance, but this is a handful of them. We have over 75 community organizations They're statewide, and we also meet with small community-based providers as well as larger community-based providers weekly to really work through policy implications and policy questions as we move forward. So this is a little bit of a kind of showing the timeline of Measure 110. I think we can all agree that it was a quick ramp up after it passed. And some of that was intentional and I think helpful in some ways. And it's also created some issues as we're all trying to get used to and adjust to the new system. So and we all know that the voters approved it in November. In February, decriminalization went into effect. Lines for Life and Billy will talk more about the hotline that was established in February 1, as well as the Oversight and Accountability Council, which is the council overseeing the rulemaking and the grant making for Measure 110. And Ron is also one of the tri-chairs for the Oversight and Accountability Council, and he can talk a little bit more about that. One of the things that we found, and we'll talk in greater detail, and I know Jackson County providers did receive some funds. One of the things that as we started talking to folks when we first got started, what we heard overwhelmingly was the concern that due to COVID and due to lack of funding, there were some really critical providers that were going to have to close their door because they just didn't have access to funds. So we worked with the legislature and pushed for early release of funds from Measure 110 to fund the services that Measure 110 was intended to fund, which resulted at the end of the day of $33 million being invested in harm reduction and recovery services in this past legislative session. We are now in the temporary rules were passed for the behavioral health resource networks in September. If you haven't gotten a look at that, that's a really good document to take a look at because they're still accepting public comments for the next couple months. And then we have a RFGP that's coming out at the end of this month for the burns, which is about $300 million to be invested in Measure 110 services over the next now until June 2023. And then the burns, which we will go into more detail, which is the behavioral health resource networks, will be established by January 1-ish.
The only thing I would add to that is that the simultaneously with the burn RFGP, the behavioral health resource network RFGP, simultaneously the Oversight and Accountability Council is working on the permanent rulemaking process.
Yes, and we have our Rules Advisory Committee happening in this week. So I think, Billy, you're next.
Hello, everybody. My name is Billy Nooneman, and I am the Addictions Recovery Program Supervisor at Lines for Life. I am also a person in long-term recovery, and I thank you for your hospitality today. So with the law going into effect on February 1, Lines for Life was contracted as a, and the statewide phone system was contracted as a temporary stopgap, so that as people are being cited while the burns are getting funded and up and running, people who are cited can still participate in a screening and get their fine waived and get connected to resources if that is something that they are interested in. OJD and OHA requested that we come up with materials for law enforcement, since this was going to be the primary in this first phase way to let people know about the program. So what we came up with was a palm card, which you see on your screen in front of you, and based upon lists from OJD, we printed up 25,000 of these palm cards and distributed them throughout the state for law enforcement. So what we are looking at and hoping for is, as people are cited, they're given this palm card. It has them, it tells them everything they need to do to get the fine waived. They call us, we'll do an initial triage and assess for safety or any acute needs. And then we will run through a screening process for the individual. We have been using an SBIRT, which is a screen-in, brief intervention, referral to treatment screening tool. And in particular, we're using a DAST, which is a drug abuse screening tool. That allows our call takers, who are a mixture of CADCs, peer support specialists, certified recovery mentors, to walk through like a series of yes and no questions with the individual about their history with drug use, and then also expand that into any other issues or needs that they have. We in particular like focus on, housing, employment, if there's any health related issues. When we are talking to people, like we try to connect them to peer services or harm reduction services in their area if they're interested in that. And then when they finish, we send a verification letter to them, which they then present at their next court date, and they have their fine waived. As we're talking to people, and if they want resources, we will offer follow-up calls to see if they're able to connect with those resources, or if they would like to work with us in an ongoing like case management position, where the call taker will just be a support for the person. We've had people that we've connected to before and after their court dates, and it's just a matter of like trying to keep like that connection going with people. And then I think the next slide, Ron. Yeah. I don't know if you all want to talk about this stuff.
Are you going? You're just going to skip the whole bill?
I appreciate you guys being, really time conscious, but at the same time, it might be very helpful. So thank you. If you don't have, if you have a minute. Okay, thanks.
We won't skip the bill. Ron sometimes gets a little ahead of himself, clearly. So as some of you may know, during the legislative session, the Senate Judiciary Committee expanded its scope for the session, and it was the Senate Judiciary and Ballot Measure 110 Implementation Committee, where we took up, putting 110 into law, or into a different way into statute, and really answering and filling in gaps and holes. So Senator Przanski pulled together a legislative work group with all the stakeholders in the virtual room, and we worked, I think it was 6 hours, some of us met for 6 hours a week, hashing out every single detail, and really having robust and important conversations. And you can imagine that not all of us agreed all the time. We had everyone from providers to the district attorneys to public defenders to cities, counties, law enforcement, sheriffs, kind of all of the different stakeholders that touch Measure 110 and now Senate Bill 755. And so we wanted to just go over some of the highlights of what Senate Bill 755 does and did, since, ballot measures are not always a perfect instrument and they leave a lot of details out, and that's intentional. But this is kind of how we see that Senate Bill 755 was not just clarified, but also strengthened. So the biggest one, which we're all in the middle of right now, is establishing behavioral health resource networks. If some of you remember in Measure 110, we were supposed to have addiction recovery centers in every CCO region, which is about 13 regions across the state. And really, we all agreed at the table that it wouldn't serve communities in the best way possible. So we agreed on counties, and we also wanted to make sure that this was really about it didn't silo the system even more by just focusing on addictions and substance use, but if there is a co-occurring disorder, that would also be welcomed in this network. So we called it the Behavioral Health Resource Network. Basically what it means is that in every county, and that's not by county government, but really if you can think of it as more as the geographical boundary, there needs to be a network that consists of housing, which is transitional, recovery, and supportive housing options. There needs to be harm reduction services available. There needs to be peer support services available and low barrier access to treatment. And that can either be one organization that offers all that. That could be 5 organizations. That could be 15 organizations. It really depends on the county. It depends on who the providers are and how they want to interact with each other. But there is about, when all is said and done, probably about $270 million that can go to establishing and setting these up. And the RFGP, the request for grant proposal, will be out this week. At least that's the hope. It's been stuck in a little bit of the bureaucratic slowdown. And so our hope is it'll be out this week, and there'll be about 4 weeks to apply. And what we're really asking in any meeting that we're in is that if you do know providers that would be a good fit for this, please encourage them to apply. And our organization is also helping, if they're small community-based organizations, to provide them with grant writing support and other support to make sure that we're really getting a diverse group of providers at the table. So that's the first thing that it did. The second was really making sure that the Oversight and Accountability Council was going to prioritize funding organizations serving the communities most impacted by the war on drugs. It also added language to recognize the 9 federally recognized tribes and tribal affiliated organizations. Ballot measure had left that out. This was to make sure that tribes recognized that they were in and were able to secure funding.
And I just wanted to add that the Oversight and Accountability Council has made a set aside for the tribes of 4% of the total burn funding.
Thanks, Ron. That's right. So then another one that we heard pretty loud and clear from everybody, I think we were all concerned, is what happens with youth in this process. It was silent. The measure was silent on youth. And actually, Molly Rogers from Wasco County created a whole different table because we all love our tables for youth. And it was a youth work group. And we kind of grappled with the issues around Measure 110 and how do we, especially when there was a Senate bill being passed that would waive fines for youth in general. How do we incentivize and ensure that youth have access to these services? So they will be referred to the juvenile system instead of going to the adult system, and they will also be able to enter into formal agreements to work through services. Another big component that we really need your all's help on is making sure that our law enforcement provides the information on how to get a screening, and that is going to change. It will be Lines for Life will still have their line up, but hopefully the burn and the local behavioral health resource network will also be a place for law enforcement to be able to refer folks to get a screening and to get connected to services. And this is ramping up, but it's not necessarily available at this moment. And then there's a really strong audit section in the Secretary of State has to oversee. I think the first one comes out in 2024. There's a lot of important metrics in there on what they need to look at and evaluate. There's also separately this isn't about the law, but the OHA has pulled together a pretty robust group, stakeholder group, where we are looking at the evaluation and the measurements and the metrics of what data do we need to collect? What are we missing? What do we have access to make sure that we're really tracking what's happening on the ground and if it's working or not. And so here's the citations at a glance. This is from the Judicial Department. It's a little bit older. We can send along the newer one. The latest numbers I think are from September 30th. And it's an additional, 50 or 90 cases. This just goes by county, kind of where your county's at. So Jackson County has handed out 25 citations. And you can kind of see it runs the gamut across the state.
This section here just kind of refers back to the timeline that that shows that in April and May, the Oversight Accountability Council did an RFGP specifically for access to care grants in order to get money out into the community right away so that folks could get the services that are promised by Measure 110. There was an overwhelming response statewide to the RFGP. There was over 115 requests for funding. The total request was over $40 million. The Oversight and Accountability Council, through a lot of advocacy that started with HJRA and our partners, the HJRA had convened policy tables that kind of mirrored what was happening on the Senate committee. There was like we had a main steering committee that consisted of a number of primarily people of color organizations, Latino Network, Coalitions of Communities of Color, NAACP, Native American Youth and Family Services, and others were a part of that steering committee. We had a criminal justice policy table that consisted of the ACLU, Partnership for Safety and Justice, and others, and health services policy table that had a number of recovery service providers and treatment providers, Central City Concern, Outside In, Bridges to Change, Miracles Club, and a number of other organizations that participated in our policy table that informed us about the urgent need to get funding out into the community. And so in kind of two separate chunks, first through a speaker's note, and then second through a budget note, we were able to advocate do advocacy that resulted in about $30 million being invested. 70 organizations were funded around the state, or funding went to organizations in 26 different counties. As you see, some of those counties were rural, southern, central, eastern, and so on. It wasn't just metro. 33 organizations increased access to treatment for the indigent and uninsured. 52 organizations stated that they were hiring new peers and peer support specialists and certified recovery mentors. 32 organizations or service providers added recovery, supportive, or transitional housing. 30 organizations increased harm reduction services. So there was quite a lot has gone out into the community. And one of the things that we're seeing is that there's kind of what we're seeing is that this is not being reported. The number of people who are actually currently receiving services funded with Measure 110 isn't getting reported. We still haven't captured that data. The OAC is working to get there, along with the stakeholder evaluation group and with OHA. And these numbers and the number of folks and the programs that are actually engaging in performing Measure 110 services, will be able, hopefully, to have those numbers by the end of this year, if not sooner. So here are just some headlines from around the state. You can see that the Rogue Valley nonprofits got money from through Measure 110. Eugene, these are just some headlines that we were able to capture that show the investment happening all over the state. Some additional headlines here, and which brings us to kind of where we're at with the investment currently.
So we talked a lot about this already, but it's about $300 million. And just of note, our understanding is that moving forward, it's going to be closer to about $250 million of biennium going into these services, but due to an opioid settlement that went into the fund, as well as some funds that rolled over from last biennium into this account. This is where we're at now. And this really is 5 times more than Oregon spends on non-Medicaid funding for these services, which is why our work and our teams really feel energized by the amount of money that's going into a system that has not necessarily seen these types of investments. And even though we are transitioning from one system to another, we are investing in some life-saving, critical, evidence-based and evidence-informed services over the next 1.5 to 2 years. And so then we talked about this. The only one we didn't talk about is the system-wide assessment. This is something that Representative Tanya Sanchez was advocating for, not just last session, actually the session before as well, was to really take a look at what is, where are we at in Oregon, what services are available, where are the gaps, and what do we need to be doing. Our understanding, and maybe Toni will be able to talk about this more, is that the Alcohol Drug Policy Commission and OHSU and the Oregon Health Authority are working on this assessment. Everything is slowed down for multiple reasons. And, my understanding is that it's at least the draft proposals coming out in November, but I could be wrong, and Toni probably knows more than I do about this. Then we know that the RFGP is happening in October, and if we can get it out, if OHA can get it out this week, then that'll still be sticking to that timeline, and that's to invest the $300 million.
All right, and I just wanted to add just in terms of the rulemaking process. So the OAC has the role of convening the Rules Advisory Committee. The Rules Advisory Committee is actually going to meet twice this week. And then once that happens, we'll move forward with the permanent rulemaking process, which includes notifying the legislature and Secretary of State of a permanent rule process, doing the public hearing, and then doing the public comment period. So all that stuff is moving forward simultaneously with the burn RFGP, which the OAC has one more step to do tomorrow, and then that should be out within the next week or so. And then there will be, as Tara said, about a 4-week period for the proposals for the opportunity to be open, and then it'll close, and then there'll be a 4-week evaluation period. Then a couple of weeks later, we hope to make the notice of awards. The OAC hopes to make a notice of awards.
Ron, quick clarifying question. I just want to make sure I'm keeping up on my acronyms. So RFGP is Request for Grant Proposal.
That's correct.
BHRN is Behavioral Health Resource Network.
That's correct.
Okay, I'm good so far, but OAC is the one that's beyond me right now.
Okay, so that is the Oversight and Accountability Council.
Great.
And they're the ones who have the authority and power to create rules and requirements for the behavioral health resource networks and access to care grants. They are in charge of the funding.
Perfect. And I want to thank everybody involved for changing the name to BURN, because when you called it an ARC, we already have the Addictions Recovery Center here in Jackson County, and so our heads were spinning. So this helps ground us a little bit and figure out where we're at.
Yeah, and Lori Paris has been a member of our policy table kind of from the beginning, and that was definitely making her head spin quite a bit. So and she was at those stakeholder meetings as well.
Right. So in terms of our partners from Health Justice Recovery Alliance, are there any questions from the audience specific to their presentation? We can have some questions towards the end as well after all 3 groups have presented today. Okay. Well, in the interest of time and to keep us moving, I'm going to pass the mic over to Toni Vesna. And I first met Toni Vesna, I believe, 3 years ago when Oregon Recovers at the Recovery Summit up in Eugene had him kick the Recovery Summit off. And from that time, every time I hear Toni speak, it basically makes me want to run through a wall to help people get access to recovery resources. But with that said, Toni, I'm going to introduce you as the Executive Director of fourth dimension recovery in Portland, but also the co-chair of the governor's Alcohol and Drug Policy Committee, and turn the floor over to you. So thanks for joining us down here.
Sure. Yeah. Thanks, Eric. And thanks, Jasmine, for working with me and doing all the logistics. I'll just preface this by saying that I've been incredibly busy and I did not put together a PowerPoint presentation, so I won't be as crispy and clean as Ron, Tara, and William. But I do want to just honor the work that they've been doing in implementing this and informing the process, especially in the legislature. It's been my experience working with the legislature that they need support in developing programs and services sometimes because they don't have that background. And so to have all of those individuals and organizations participating in the implementation was really important in making something sensible. Primarily what I do is run the Fourth Dimension Recovery Center. Like Ron and Tara, I'm a person in long-term recovery. I just celebrated 9 years. I do just want to say that, I know that y'all in the criminal justice world have taken a lot of heat, over, the course of the last few years. And I do want to say that, part of the response to addressing addiction was placed in the criminal justice system's hands for various reasons. And now we're moving it over to the healthcare system. And I think it's really exciting time. I'm not here to beat you guys up. The criminal justice system intervened on me when I needed an intervention. And if you look at national data, TEDS data, treatment episode data sets that the federal government collects, if you look at 35.5 million referrals to treatment that happened between the course of about 2002 and 2017, you'll see that the majority of referrals to treatment came from the criminal justice system, about 33%, and then individuals. So those two things. And healthcare was really low. And so, healthcare needs to step up its game too. And we're going to continue that fight and pushing healthcare to take responsibility for this. You should be able to walk into an emergency room and get help immediately, and oftentimes what happens to people is, who have substance use disorder, they go into the emergency room and then they call you guys to get us out. And I've had that happen and stuff. So there's a lot of work that needs to happen. And I hope that we can partner with the criminal justice system in helping people recover because they can and they do with time. And it can take several episodes. I wasn't the friendliest dude or the funnest to deal with when I was in my addiction, but I'm a pretty damn good guy in recovery. And I can say that about a lot of people in recovery when they get there, including Ron and Tara. So what is 4D? So 4D is a peer-run organization, also known as a recovery community organization. Essentially, me and other people in recovery provide recovery support services, non-clinical recovery support services. So that's different than treatment. In treatment, people have to get a clinical diagnosis to go to treatment. Some of you guys have probably helped people get into treatment. The first thing you have to do is get an assessment, and then you're prescribed treatment. And it's usually short in duration. On average, it's between 30 to 90 days. There are some longer treatment programs, but it's actually getting shorter over time. Now, after that, a person needs to figure out what their recovery is for the rest of their life. I had to figure it out, and so 4D is a recovery organization that really focuses on that for young people, to 18 to 35-year-olds. We have peers in recovery who operate out of recovery centers. And our job is to go out and sell recovery to people through our own, not literally sell it to buy it, but to market it to them as something that they can and should do, and to inspire them to take action in their own recovery. So 4D is heavily invested in outreach and engagement. We go out in the streets and do outreach and engagement. We host needle exchange, and we engage people, talk to them about recovery, share our stories, inspire them to change their life, inspire them to take those next steps. We want to partner with everybody. We want to partner with the police. We want to partner with the prosecuting attorneys. We want to partner with public health. We want to partner with colleges. We want to partner with treatment centers and detoxes. We want to partner with everybody so we can be there to respond to when a person needs help. And that's the new system that I think we should be creating and that we're advocating for, is a system where we're not waiting for people to have to get arrested to get help. we're being more responsive than that. We're going out and meeting people wherever they're at. Like if I'm in the dentist office getting my tooth pulled because I was smoking meth, which is my story, like I should be getting talked to about my problem, but that doesn't happen. So we have a long way to go, but I think we're going to get there. So 4D also has these recovery centers that are open, 365 days a year, and hundreds of people go to them every single day. They go to them for meetings, they go to there to socialize and hang out and find a girlfriend or boyfriend or whatever people do in recovery, especially young people. They go there to party, make friends and stuff. But it makes it really attractive to young people when they can go hang out with other young people and do the same shit that they'd be doing using, but they're in recovery, and lots of people come and we have really good data. Now we currently have 3 recovery centers. I work with several other recovery community organizations like the Miracles Club, which focuses on African Americans, Instituto, which focuses on Latinos and Spanish speaking populations, the native population is represented by Painted Horse Recovery. And it's like the long-term recovery support that people need that's community-based, that they can go to before or after treatment. Now, if you look at the Surgeon General's most recent report on facing addiction in America, there's an entire chapter dedicated to recovery support services. And in that chapter, the Surgeon General states that we should be developing systems of care that are chronic in nature and support people up to at least the 5-year mark. Because at the 5-year mark, a person's likelihood of having a recurrence of use drops down to about 15%, which is the equivalent in a person developing a substance use disorder in the first place. So in the context of Measure 110, through the recovery support service lens, there's a lot of potential, to increase services, for recovery housing, peer services, stuff like that. Will that shake out through the burns? That's yet to be determined. I think Tara and Ron and their group is doing a good job of continuing to push on the Oversight and Accountability Council to make those investments, but we'll see how it unfolds. We also do a lot of advocacy and education. So we go out and, we advocate for increased resources to recovery services. And we do a lot of education about what recovery is. What does recovery look like? How do people recover? How do you intervene and talk to somebody? So we do all that. And I'll put something in the chat of our annual evaluation that we did in 2020. It's about 40 pages long. It really delineates what we do and the efficacy of it. But I just want to pivot and talk about more broad systemic issues that the state faces that I think are getting fixed. Like I'm hoping that some of our Oregon way can get fixed and, here through some really intelligent and impactful policy tweaks. So I'm the chair of the Alcohol and Drug Policy Commission, and the ADPC's job is really to make a strategic plan, to address the addiction crisis, and then to grade ourselves every year on how, effective we are in doing it. We focus on, 4 different sectors, slices of the pie to address the issue. The first one is prevention. I've been really advocating for an increased response around prevention efforts. Currently, if you look at how much the state spends on addressing substance use disorder, less than 1% of all of our resources go to preventing it from happening in the first place. That's pretty bad. That's just like waiting for things to get bad. So we need to increase the investments to prevention. We're working on that. And then we have access to treatment. So in this new post Measure 110 world, we're basically saying like, we need more treatment and people, need peers and stuff like that. But at the same time, we're having a decrease in treatment bed availability and detox services. And so, we're continuing to push on the state to figure out how to increase access to detox and access to residential services so that when a person connects with a peer, whether it's one of your cops who engaging with somebody who connects with a peer program and gets them hooked up, like, okay, we got them connected, they're ready to get help. We still need access to other services to make sure that they can, continue on their journey. So we're focusing on that. Developing new paradigms around intervention. My big push is to increase the competency in the healthcare system, was particularly the professionals who work in healthcare. Not very many healthcare workers get any sort of training on how to have a discussion about addiction, how to intervene, or how to refer out. And so I've been really wanting to push on them to do that, because, you know, it's their responsibility more now. Like, ideologically, the people have said, this is what we want, this is what we believe, and, you know, I'm in harmony with that, you know. And so we got to get healthcare built up to be more responsive to the needs. And then the last thing is really focusing on ongoing recovery support services and new innovative programs, which I'm hoping Measure 110 can help seed, you know, and start to grow that infrastructure. You know, one being like the recovery high school. We have one recovery high school in the state of Oregon that can serve about 20 kids. You know, that's not enough. You know, we know that we have pretty high prevalence data of substance use disorder if we look at, you know, the National Survey on Drug Use and Health, but the response isn't meeting the need. Part of the problem with that is that, you know, the Oregon Health Authority doesn't report out on the data it collects for treatment episodes. So we provide lots of funding to services, but nobody's publishing the data, you know, and we know that we've had an increase in use since the onset of COVID. Now, some people are conflating that with, you know, the implementation of Measure 110. I don't think that's correct. I don't think we have the data to support that. It's too early, for one. You know, I'll be the first to say I was against the implementation of Measure 110 in the beginning, because I thought it could have had stronger policy framework to make it more effective. But, you know, I could be wrong. You know, I'm one person. I don't think we can say that Measure 110 is causing more people to use. I wouldn't make that. It's too early on. But what we can say is that we know we have some increased use. We know that substance use overdoses have gone up about 37%, and that alcohol overdoses have gone up 73%. Now, the state doesn't have like an epidemiological tracking board to say this is how it's happening in these counties, this is what we need, this is the type of people who need different services. And we know that they can do it. I know that they can do it because every day I get updates on my phone about presumptive cases across the state, presumptive COVID cases. Maybe somebody has COVID, you know? So I know the state has the bandwidth and ability to do it, but we have to all band together and continue to push, you know, the state to do a better job. We all have to work together. You know, people in recovery and advocates, the police, healthcare, we all have to work together to solve this issue, because it is of high, you know, importance in Oregon. It's a huge problem. Lots of people are dying. Lots of people are losing, you know, their children and stuff like that. While we all know that people can and do recover, you know, and oftentimes when people get into recovery, they become some of the best people there are. And that's just been my experience. They become dedicated servants and stewards of the community. Then we have, you know, we also have some additional funding coming in. You know, we'll have funding coming in from the Biden administration. And I'm super sure of that. I'm involved in a lot of national advocacy efforts around legislative concepts and stuff. So we're gonna have more money come in from Biden, and then we'll get some of the opioid settlement money. You know, I'm working with the DOJ on, you know, getting that finalized with the counties through negotiation. So, you know, that might be a little bit more money, but ultimately we need to have a strategic response, and we need to work together to address the issue moving forward. That's pretty much all I got to say. You know, I'm just really grateful and honored to be here, you know, with so many of y'all, and appreciate sharing time with Tara and Ron, who are kind of like my predecessors. So I always want to honor them and all the work they've done before I came in to recovery.
Thank you so much, Tony. Does anybody have any questions specific to Tony's presentation? Okay. Well, we'll turn it over, and this is a little bit, this is definitely the part of our presentations today where the mood gets a little more somber. Sorry to introduce you that way, Tanya, but as our local person tracking the deaths related to opioid overdose and other things, it is important to note the framework that we're still looking at substance use within our community, which is that we have people dying, and it is devastating. And the hope that new services bring sometimes aren't enough to overcome that. So Tanya, I certainly turn the floor over to you as you bring this to the conversation, and thank you for joining us. Oh, and I also, before you fully take over, I need to acknowledge that you have been so deep in your work regarding our county's COVID response. we are so grateful for it. And that when the executive team was talking about inviting you, there was a really strong air of protection, particularly from Danny Jordan, about how much work you're doing and not wanting to overburden you. So the fact that you made time for this, we're all very grateful. So thank you.
Oh, yeah, no problem. I've been doing the best that I can to keep an eye on our overdose data. But yeah, it's definitely been a hard year for this and COVID. So my name is Tanya Phillips. I'm the Health Promotion Manager here at Jackson County Public Health. I'm going to go over really our overdose surveillance and alerting system that we developed in 2018. And really, we developed this system to inform partners and our public about the trends that we were seeing in our community and be able to issue alerts in real time so that we could possibly save lives in that process. So our surveillance system, it is not a way to track the exact number of overdoses, but it's really looking at our first responder system and looking at our overdose fatalities so that we can identify those trends and again, issue alerts. So again, we started this in 2018. It was developed due to the sudden increase in fatal overdoses related to illicit or synthetic opioids. And then this was also done in close partnership with the Medford Police Department, Mercy Flights, our medical examiner staff within the Jackson County Sheriff's Office, and then additional support from our healthcare systems to do this work. So looking at 2021, we issued our first alert the very beginning of September. So January 12th. This alert lasted just a few weeks. So typically I would say our alerts really do last anywhere from 2 weeks to 4 weeks. And we issued this alert based on the number of responses that law enforcement, EMS, and also what our emergency departments were seeing. So during this time, there were no fatalities from synthetic opioids. Also during this time, just to let people know that we did remove our colored system. So it used to be green, yellow, and red. And we did away with that. One of the reasons is because media would get really fixated of, well, why a yellow, why not a red? Each time that we would make the determination to issue an alert, it was a little bit different each time. And so it just became a lot easier just to issue an alert without having a colored system there. So then we issued our second overdose alert on February 28th. This alert has remained in place since then, so it's been 8 months. This is our longest overdose alert. During this whole time, we have had the record number of hospitalization, first responder for their responses, and then also deaths as well. And so just to kind of give you some background knowledge, looking at 2019, we technically had 2 alerts that we issued. Again, those were either 3 or 4 weeks. We did one in December that carried over into 2020, and that lasted through January. So that was at 4 weeks, and that was our only one. So again, to have 2 alerts, but then have our last one still in place has been impactful in the sense of we haven't been able to remove that alert and say that we've gone back to normal per se. And then also with this, Tony, you may not like me, but I've been a part of a group looking at Measure 110 for some assessments. And one of the concerns that I did raise was, looking at Measure 110 and doing an assessment on how this may be influencing our overdoses, but also just the drug trends and making things such as fentanyl, which is what we're seeing majority of, if it has influenced any of that. So that is my voice at the table right now. So this is looking at our law enforcement responses. And so I get a lot of this data currently from a system called ODMAP. Medford Police Department and a few other departments put data in here directly where they make a response. Sometimes they do deploying Narcan. Sometimes someone else has already done that, such as a bystander. And so I go through and I'm really looking at the synthetic opioids. So sometimes there are other overdoses related to methamphetamine, sometimes alcohol, cocaine. I'm not pulling those right now. This is really just looking at that synthetic data. So Medford Police Department is one of our agencies that uses this system the most. And so they've been a really vital partner in this to being able to give us an accurate picture about what is going on in the county. So far through week 42 of the year, we have had a total of 172 responses to synthetic opioids. So this is when an individual is overdosing. Majority of these responses, unfortunately, are from our Medford Police Department. In comparison to 2020, there were only 53 responses, and majority of those were from, again, sorry, MPD, but we also had Talent and Central Point also putting into that system. One thing that's different this year is that MPD is trying to help get a better picture of what's going on in the county, so they are helping us get additional information from the other law enforcement agencies. But overall, I would say, the responses for law enforcement has increased, had a fourfold increase from 2020 to 2021. We're averaging about 4 responses per week compared to 2020, where there was just averaging about 1 per week. Also to take note, which I didn't mention before, definitely pay attention as we go through these graphs, looking at week 26, I'll point with my mouse, hopefully you can see. So week 26 for most, and then also week 36. So you'll definitely see the trends match between the different agencies. So this one is looking at EMS. So our main provider here in Jackson County is Mercy Flight. And so they give me information directly. The information that they do give me is when Narcan has been documented as an intervention. And with that, then a transport was made to one of the hospitals because further care was needed. A majority of the time, if Narcan is identified as an intervention, it's typically when Mercy Flight staff, the paramedics, are administering naloxone or Narcan themselves. So in 2021, so far, Mercy Flights has had a total of 141 responses where Narcan was identified as an intervention and the person required to be transported to the hospital for further care. In 2020, we had a total of 153. So far we are unfortunately on par to surpass last year's record. So far we're averaging about 3.4 responses per week. So we're expected to see around 175 responses just from Mercy Flights. This one is looking at our overdose admits in our emergency department. So for those of you who don't know, we have three hospitals here, 2 systems. And so that's where that information is coming from, those emergency departments. We use a system called Essence, which is a syndromic surveillance system that we have access to at Public Health. We use 2 queries. These queries are based off of chief complaints, which really covers why the individual is being seen. But then we use diagnostic codes that are used by the hospital to then say, what the reason is for them being admitted. And so I have 2 queries that I use. One covers heroin and the other one is just general opioids, which is kind of my catch-all. And so these do, again, use those diagnostic codes. So overall, we have had so far this year 169 overdoses where someone was admitted to the emergency department related to synthetic opioids. And again, I'm only looking for synthetic opioids within these overdoses. Mainly, again, most of the time I'm seeing heroin and fentanyl. This year, we've averaged about 4 admissions per week, so very similar to what law enforcement is seeing. In 2020, we averaged 1.7 admissions per week, and in 2019, it was 2.2 per week. And so really looking at from 2020 to 2021, this is a 2-fold increase. And so again, you see that week 26 and also week 36 all mirror each other within the system. This year, what has been different in the past, when I'll go through the queries also provide me additional information if there's chart notes, so those get put in there. So I'm able to see additional information such as the type of drug that the person is naming that they used or thought that they used, but also the route that they used to use the drug. So this year, what has been different in the past is that other opioids, what typically would be there would be an older individual, and what would be listed as they just had like something like a hip surgery, and or, you know, they were a cancer patient. So you were really able to see, you know, that was a prescription accidental overdose. What we're seeing this year is a lot of mentions of fentanyl and counterfeit pills. And so I've had to go through the data and now be able to list out all the different mentions of what the person thought that they possibly were using. So this graph, the blue is just looking at the mentions of heroin, or they were diagnosed, or the diagnostic code that was used was heroin. The orange and the gray line is under the general opioids. And what I did is I went through any mention of fentanyl, I counted it as a fentanyl overdose. And then the gray is just other opioids. So overall, there were 86 admits for a heroin overdose, and then 97 under the other opioid overdose. And then there were 51 mentions of fentanyl that were specifically identified in the chart notes of the individual saying that is what they use. And that's something very different this year than what I've seen in the past. Looking at the other opioids, things that I see mentioned are people saying that they used oxy, blue oxy, dirty 30, or they will describe the pill. So a 30 milligram pill that was blue. One of the incidents that I identified was a couple of teens. They said that they used Percocet, but then they described the 30 milligram blue pill. Percocets do not come in a 30 milligram blue pill. That was oxy, and what I would suspect would be counterfeit as well, just because of the age and being able to access it and just knowing what is going through our community right now. Other ones were, again, mentions of other Percocet. It was called street Percocet, Xanax, people mentioning that they used strange meth, powdered meth, or thought it was meth. In some of the heroin overdoses, it would be mentions of calling it bad heroin. So I would suspect there was fentanyl in the mix there as well. Smoking fentanyl patches. And I mentioned Xanax. Yeah, so those are kind of just, you know, what I can gather from the chart notes. The chart notes are pretty important when we're looking at some of this data. Other information that I found useful, and that has changed quite a bit. So the route of drug use is really important factor, especially when it comes to harm reduction. We know that injection drug use carries the riskiest of them all, just with the spread of HIV, Hep C, other infections, and then the risk of overdosing. Smoking, typically in the world of harm reduction, is a less riskier way to use drugs. If we can get someone from injecting to then smoking, that's a good thing. You know, there's just less risk of infections, less risk of overdosing. Unfortunately, what I'm seeing with the data, though, is when it comes to fentanyl, the risk of overdosing, whether it be non-fatal and or fatal, the risk is still there. It does not eliminate it by any means. And so I'm just finding it's not much safer right now. And so going through the data, what I found is mentions of where there was heroin, they were more likely to be injecting. Where smoking was mentioned as the route of use, they mentioned that they were smoking fentanyl. And then any other opioids, for snorting, it either mentioned fentanyl or other opioids like the Xanax or the Percocets. And so also there was a recent study coming out of San Francisco that also noted that they're starting to see less people injecting drugs, especially if they're using fentanyl. So they are seeing more people smoke. So again, that's a different trend as we start to see more fentanyl and pills come through our area. I am seeing that trend change. I'm also seeing our syringe exchange numbers go down because people are not injecting. Clients or even telling us the reason is because people are smoking and using fentanyl. Other information that I found important, the average age of the overdoses was 35 years old. The minimum was 15, and then the oldest was 77 years of age. And then the majority of the emergency department admissions were males. And so 75% of that total were males. And then the average age was 35. On to information about looking at our fatalities. So this information currently, again, I'm pulling specifically looking at synthetic opioids, so fentanyl and heroin, and or anything related to that. I would give a little disclaimer about 2020. There were some staff changes in our medical examiner office, so I wasn't getting that information as I typically would. And currently for 2021, the Medford Police Department is helping me get a better picture and reporting those fatalities to me, no matter where they're at within the county. So they've been really helpful in that process. But as you can see with this graph, currently in 2021, we have 43 fatalities related to synthetic opioids. Some of these are confirmed cases, some of are presumptive, and some are still suspects. So part of our surveillance system, we have three terms that we use. Suspect is just right when it's reported. So the information that we get is sometimes they're a known individual to use heroin and or other synthetic opioids. A lot of times the scene at, there'll be different drug paraphernalia that would indicate that that's what they overdosed from. So that's a suspect case, and we identify that because, again, we want to be able to track the data in real time. And if we need to issue an alert within a day, within a few days, or a week, we can't wait on toxicology reports to confirm what that individual may have overdosed from. And so that's kind of the process for that. So looking at fatalities, I did this per month just because there's not an overdose fatality every week. So this is looking at everything per month. We're really averaging right now about 4.3 deaths per month. And that's about a little bit over 1 deaths per week. In 2018, which was our highest year since we started our surveillance looking at illicit or synthetic opioids, we were averaging 1.8 per month, the deaths. So that's a 2.4-fold increase just looking from those 2 years. And again, these are all record numbers as well, whether it's weekly, monthly, and or just the total for the year. This slide right here is really just comparing heroin and fentanyl, just the number of overdoses there. And so all of these include, the numbers include confirmed. So we've received toxicology reports back, but also presumptive and confirmed. Presumptive cases for us include sometimes if the tox report will come back that they had morphine, but then the drug scene or the individual, we know that they did use heroin, and sometimes the body would just burn off and it would come back as morphine. So that's our presumptive case there. But so far for the year, we've had 20 deaths related to heroin and or 25 related from fentanyl. 4 of those individuals had both heroin and fentanyl so far identified, whether it's confirmed or looking at the death scene, they're both products were there. We have 1 presumptive case that came back, just morphine. 16 so far of the other drugs, the tox reports have identified other drugs in the system, such as cocaine, meth, marijuana, Xanax, which is important because we have been seeing some counterfeit pills with fentanyl that were labeled as Xanax. And then so far, we still have 25 of the cases that are still pending the toxicology reports. Looking at the demographics, very similar to hospitalization. So average age is 38 minimum, has been 17 years old, and then the maximum so far has been 66 years old. Looking at sex or gender, majority of the deaths are among males, with 76 of the fatalities being males and 24 of the fatalities being females. So again, very similar to what we see with hospitalizations. And that is the end of my presentation.
Tanya, thank you so much for sharing that. That is disheartening and devastating to think of the loss in our community, and it heightens the need for our systems response overall to provide supports and services for people when they need it. Does anybody have any questions specific to Tanya's presentation today? Okay. I want to open it up if anybody has any comments generally regarding the three presentations we've had today, both from our Health Justice Recovery, HJRA Alliance, and who led off Toni Vezina from 4D, as well as the Governor's Alcohol and Drug Planning Committee, and then Tanya from our own local health department in terms of our response. I certainly had took very important things away from each of them. And number one is just the way in which HJRA is working with the state to make sure that funding is coming into each of our communities, understanding how time is of the essence. And as we've taken away one system response, the other one needs to be stood up in a very quick manner. And then Toni talking about a number of things, but also the need for a recovery support system. I think historically we just looked at, well, they need treatment, they need this. And a lot of our folks weren't ready for treatment, and we didn't have a system of care that really met them at the level that they were at. They also, the need for our healthcare system to step up and be major players in this effort. And then finally, Tanya just impressing upon how important it is and how lives really are at stake on this issue in terms of how we respond. So Tara has put some things in the chat. Toni has a link in the chat. And I would encourage anyone who has questions. They've been a very responsive group, and not that they need anything else on their plate, but they also would be really willing to field questions or comments via email. And if there's a resource that you have questions about, they can be reached there. And I think, Tara, did you put information, or Ron, around the BERN, the Behavioral Health Resource Network rules in the chat at all?
We haven't, but what I can do is I can email you the actual temporary rules.
Okay, great. Thank you, Ron.
Hey, Eric, quick question.
Absolutely. Sure. Yes.
I didn't know if it got covered. I might have missed it, but do we know how many people have had a successful transition into like treatment or recovery through the program offered by Measure 110?
You want to go, Ron?
No, I spoke to that a little bit in the sense that we had that the Oversight and Accountability Council got $30 million out to over 70 organizations around the state. However, we just haven't gotten reports back from those organizations. You know, they said, but they told us what services they were going to provide. You know, treatment, peer support, housing, and harm reduction are the things that they are currently providing in all those communities in 26 different counties, 70 organizations all over the state. The Oversight and Accountability Council just hasn't gotten a report back, but the Oregon Health Authority, which supports the Oversight and Accountability Council, is compiling that information, and they should have kind of some data by March, I would think.
I would say one of the, I don't know if it's a downside or however we want to look at it, is this, the good news is that there's no wrong door to accessing these services. So anyone in the community can go in and they don't need a citation. The unfortunate component of that is that we equate a citation with accessing the services and then want kind of the data behind that. And so I think that as we move forward, and what Ron said of once we're able to track a little bit more of what I put in the chat is these are the organizations and providers who received funds in that initial grant funding that put down Jackson County, or they were statewide. that they serve this county. And so, whether or not, depending on how folks get into any of those organizations, if they were funded through the 110 funds and are invested in by the 110 funds, then they're being impacted by 110. It's just a different metric than citation plus burn equals success or failure. And so I think it's incumbent on all of us to kind of get that model out of our heads, at least in some regards, because ultimately our goal, at least, and I think everybody's goal on this call, is to connect people to serve the right services at the right time and ensure that there aren't any barriers to those services. And so that's really what we're working towards, and it's going to take time.
Thank you. And I just wanted to maybe shore up a number just for everybody to have on, because when Tanya, she reported all the opioid overdoses, but we track all of them through the county too, through our medical examiner's office. And unfortunately this year we're at about 75 confirmed or presumptive overdose cases, which last year we had a total of 41. So it's looking pretty bleak to at least double that number this year if we're on current pace. So impact to our county has been pretty significant.
Well, thank you to each of you for your willingness to make a presentation to our local committee here. I know you all have commitments throughout the state, and while I'm certainly partial to Jackson County, I appreciate the work that you're doing on all the local levels. So Ron and Tara and Billy and Toni, thank you so much. And Tanya, as always, being our local partner and connector. And we look forward to putting supports in there, and we are optimistic about the opportunity to help. And we are scared for the people who are hurting and dying. So all those things certainly at the table right now. So thank you all very much. So
thank you.
Thank
Thanks,
you.
everyone. Please feel
Yeah,
free to
later.
reach
Thank
out.
you.
all right. And before we adjourn the meeting, though, we do have some local public safety coordinating council business. We do have a quorum now, I believe. Jasmine informed me. And so we have minutes that were submitted for the September meeting, I believe, as I pull those back up.
I move approval of the minutes.
Second,
Danny Jordan with the approval. And who was the second? I missed the second.
Mayor Sparacino.
Mayor
second.
Sparacino, thank you very much. All right, so Danny Jordan with the motion, Mayor Sparacino with the second. Jasmine, will you take a roll call vote, please, on the minutes?
Okay, Joshua Aldrich,
Yes.
Travis Christian,
Yes.
Scott Clausen,
Yes.
Dave Dotterer,
Yes.
Doug Engel,
Yes.
Eric Geyer,
Yes.
Beth Eckert. I think a few people might have jumped off. Barbara Johnson,
Yes.
Jennifer Lind, and then Hilda is out.
I'm here. I'm a yes.
Hilda, you're still here? Okay, good.
Yes.
Sheriff Sickler,
Yes.
Rita Sullivan,
Yes.
and Mayor Sparacino,
Yes.
and then Danny Jordan.
Yes.
Okay, that's everyone.
Jasmine, didn't we have our newest member who was appointed recently? Is Nathan Olson?
Yeah, it's been moved by the board. We still have one more step to go until it's fully approved, but it's moving along.
Okay, great. So we'll look to welcome him formally. But Nathan, thank you for joining us today. And that'll be moving forward shortly. So again, I want to thank everybody to their commitment here today. And we will get together next month for our next local public safety coordinating council. And should you have any ideas or suggestions, please feel free to contact me as the chair. Take care, everybody. We're adjourned.